Hello, my name is Tyler Dawson. Today we'll be doing the eyes, ears, nose, and throat exam. First thing we'll be doing is check in, take a look at your visual acuity. What I'm going to do is I'm going to hand you this chart, and what I want you to do is please read the smallest line of letters you can for me, please.
428-365, 3E's, 0x063.
Wonderful. Can you cover one eye and read the smallest line for me?
428-365, 3E's, 0x063.
Great job. Can you cover the opposite eye and read the smallest line for me again?
428-365, 3E's, 0x063.
Very good. Finding visual acuity is 20/20 bilaterally. Next, what we're going to do is we're going to test your visual field screening. So what I'd like you to do for me, just look at me, straight forward, look at my nose. I want you to tell me when each of my hands come into vision, okay?
No.
Beautiful.
No.
Beautiful.
No.
Wonderful.
No.
Okay, very good. Good full visual fields in all quadrants here. Next thing we're going to do is we're going to take a look at just basically your overall eyes, okay? I'm going to just kind of take a quick look and inspect your eyelids and your lacrimal ducts. Everything looks good there. Lids and lashes show no deformities. Next thing we're going to take a look at is your conjunctiva and your sclera. So I'm just going to use my fingers here, kind of open up your eyes a little bit, okay? Very good. Can you move your eyes up and down for me? Left, right. Very good. Same thing over here. Up and down, left, right. All right. Very good. Conjunctiva are pink and your sclera is white. All normal findings there. Next thing we're going to do is take a look at your cornea and your lenses. So what I'm going to kind of do is I'm going to shine a light here, kind of lateral to me. If you could look forward here for me. Very good. Keep looking forward for me. Very good. Lenses and cornea look good. No opacities. Next thing we're going to kind of do is we're going to take a look at your pupils as well, okay? I want to see how those react. So if you don't mind, I'm going to shine a light in your eye again. Just keep looking forward for me. Very good. Very good. Your pupils are equal, round, reactive, and accommodating to light. Next thing I would like to do, I want you to look at my nose here. And I want you to follow my pen light with just your eyes, okay? Very good. Extraocular movements are intact. Conjugate gaze is present. No nystagmus. You have good convergence as well, okay? What I am also going to do is going to take a look at your corneal light reflections, okay? So what I want you to do is I want you to just look at my nose here. I'm going to shine a light on the bridge of your nose and I'm going to see how your eyes react, okay? Very good. Light reflex is equal and symmetric bilaterally. Next, what I'm going to do is I'd like you to cover one eye for me. Kind of hold it there for about 10 seconds. Okay, go ahead and release it. Very good. I want you to cover your opposite eye. Do the same thing for me. Go ahead and release it. Very good. What I was looking for there was for some deviation in your eyes. There was no deviation or movement in your eyes. Next thing we're going to do ophthalmic exam. Not an eye doctor, but we got this. So what I'm going to do, this is basically going to take a look at your optic disc and your veins and your arteries in your eye, okay? So what I want you to do is just kind of look forward to me, okay? And what I'm going to do is I'm going to look into your eyes, okay? Okay, very good. I'm so sorry. You okay? All right. Basically, what we're taking a look at here, your red reflex is present bilaterally. Your optic disc is yellow, orange, with very sharp margins. Cup is less than half a disc. Both your arteries and your veins are distinct. Don't appear to have any hemorrhages or exudates in your eyes. Long story short, eyes are looking good and healthy, okay? Next thing that we are going to do, we're going to kind of inspect your ears and kind of do some hearing exams, okay? So the first thing I'm going to do is I'm just going to kind of feel around, just kind of do a visual inspection of your ears here. Okay, very good. Wonderful. Any pain or anything like that?
No.
Wonderful. So your auricles, your trachea and and your trachea and your mastoids are without deformity, lesions, edema, or tenderness. Next thing I'm going to kind of do is I'm going to take a look into your ears here with the otoscope and just kind of check your ear canals, your tympanic, and your tympanic membranes, okay? Okay. Very good. Ear canal is clear, no discharge. Your tympanic membranes are pearly gray, translucent, with intact landmarks and cone of light. Next thing we're going to do is we're going to kind of do some hearing tests here. So what I'm going to do, I want you to occlude one ear. I'm going to whisper in your ear, and I want you to repeat the word I say, okay?
Basketball.
Okay. Can you cover your opposite ear? We're going to do the same thing, okay?
Volleyball.
Very good. Sound heard equally in both ears. Next thing we're going to do a Weber test. So what I'm going to do is I'm going to place a tuning fork in the center here. I'm going to vibrate it, and I want you to tell me if you can hear the sound in both ears, one ear, or not at all.
I can hear it in both.
Very good. Sound heard equally in both ears. Next thing we're going to do is we're going to do the Rhines test here. So what I'm going to do is I am going to use the tuning fork again. I'm going to place it at the base of your ear here. What I want you to do is I want you to tell me when you can stop hearing that sound, okay? I'm going to flip it around, and I want you to tell me, I'm going to hold it next to your ear, and I want you to tell me if you can still hear the sound, okay?
I can hear the sound. I don't hear the sound. Or
Let's try this again. I'm going to do it again, okay? I want you to tell me if you can hear the sound when I flip it over, okay?
okay.
Do you hear the sound?
Yes.
Tell me when it stops.
No.
Do you hear the sound now?
No. Yes.
Okay. I'm going to do the same thing over here on this ear, okay? Tell me when you stop hearing the sound.
No.
How about now?
No. Yes. Oh yeah, I hear it.
Okay, very good. Air conduction is greater than bone conduction bilaterally, which is what we want to see, okay? I'm glad we can hear in both ears. That's great. Next thing we're going to do, we're just going to basically inspect your nose and your sinuses, okay? I'm going to just take a visual look at your nose here. Nose looks great. Your nose is midline. You have no deformities. That's great. No need for a nose lift. I'm going to feel down for it. What I want you to do is I want you to tell me if you have any pain or any sort of sensation when I press on your nose, okay?
Nope.
Wonderful. What I want you to do is I want you to plug one there for me. Breathe in and breathe out for me. Very good. Include the other nair. Breathe in, breathe out for me. Very good. Sound like your nairs are pretty patent bilaterally. You don't feel like you can breathe harder or easier out of either one of them. Beautiful. What I'm going to do now is I'm going to take a look at the inside of your nose here with some light. I'm so sorry. I know it tickles. Very good. Just taking a quick look there. Your nasal mucosa is pink and moist. Your septum's midline, no polyps or lesions, okay? What I'm gonna do is I'm gonna feel on your frontal sinuses, okay? I want you to tell me if there's any pressure or anything of that nature, all right? Any pressure or tenderness?
No.
Okay. Very good, very good. No tenderness over frontal or maxillary sinuses. Next thing we're going to do is we're going to just take a look at your mouth and throat, okay? So basically what I'm going to do is I'm looking for the color of your lips, your oral mucosa, your teeth, your gums, hard and soft palate, your pharynx and tonsils, okay? So what I would like you to do for me is, can you open up your mouth and say for me? You already knew what I was going to ask, didn't you? Very good. Very good. I'm going to move your tongue from side to side here. Okay. Very good. Very good. Taking a quick look. You have no swelling, bleeding, or dental caries, so your dentation is intact. Oral mucosa, pink, no ulcers or white patches. No tongue is pink, no lesions and no white patches on the tongue. Hard palate is intact, no lesions. Your uvula is midline. Your soft palate is pink, tonsils 1+, no urethra or exudate. And pharynx and tonsils, again, no urethra or exudate. Tongue is pink, again, no lesions of any nature. What we're going to do is we're going to next do kind of just take a look at your lymphatic systems, okay? So we're going to do your lymph nodes of the face, all right? Now I'm going to palpate those, and I want you to tell me if you have any sort of discomfort when I do, okay?
Okay.
All right, first ones we're going to do is your preauricular, okay?
Nope.
No, okay. How about your postauricular?
Nope.
Okay. Next we're going to take a look at your occipital ones.
Nope.
Okay. Next we're going to do your tonsillar. Okay.
Nope.
Okay. We're going to do your submandibular.
Nope.
Okay. Next we're going to do your submental.
Nope.
Okay. Next we're going to do your superficial cervical.
Nope.
Okay. Next we are going to do your anterior cervical.
Nope.
Okay. How about on this side?
Nope.
Okay. We're going to do your post cervical.
Nope. Nope.
All right. The last two we're going to do is your supraclavicular and your infraclavicular. Okay. So I'm just going to kind of pull these back here. Any pain or tenderness?
Nope. Nope.
Any chance? Very good. Beautiful. Simple findings. It seems all nodes are non-palpable, non-tender, and no enlargement. Okay. Congratulations. That concludes our eyes, ears, nose, and throat exam. Do you have any questions for me?
I do not.
Wonderful. Thank you so much.